Now, just over 26% of the population in South Africa is fully vaccinated against COVID-19. The Centre for Health Systems Research and Development has done a study to determine people's vaccine literacy during this period. So to tell us more about the outcomes, says the Centre's Professor Michelle Engelbrecht. Thank you for your time, Prof, and thank you for joining us. Good morning. I suppose let's start here. The importance of vaccine literacy. Before we get into the study and the findings, how important to have this conversation and to continue to raise awareness around vaccine literacy?
Good morning, and thank you very much for having me. Yes, it's extremely important. From the findings of our study, we see that vaccine literate individuals are more likely to go for the actual vaccination. So I think this just speaks to the importance of having knowledge and having the information available that helps one to make an informed decision to be able to weigh up the risks of taking or not taking the vaccine.
Yeah. So when we then zone it into the coronavirus, but also the different variants that we're seeing, the latest being the Omicron variant, I mean, what does this particular variant tell us about the unpredictability and resilience of this particular virus?
Yes, we see that the virus keeps mutating, and we know that the more vaccinated people we have, it tends to lower the number of mutations that occur. So it again just speaks to the importance of everybody being vaccinated so that we can try to prohibit the spread of the virus even further.
Yeah. And when you conducted your study, Prof, I mean, what did it tell you about, the general population's ability to, collect as well as to understand information around vaccines before making a decision on whether to take the jab or not?
So we looked at vaccine literacy, and it was looked at in terms of two different components. Firstly, looking at functional literacy, which is really speaking to, are people able to understand the information that they've got? Are they able to read it? Are they able to comprehend it? And the other component is looking at the interactive vaccine literacy, which is, can you use this information and can you make decisions using this information? And it was very important to say that we found that vaccine literacy was quite high on both these scores. However, if you looked at the two different ones, people were more likely to be making the decisions than maybe to be actually understanding the information that they have.
Right. And Prof, would you share how you conducted this research?
Yes, we did an online survey. It was available during September, which was also the month when persons 18 to 34 years could now start to go for their vaccine. And it was available on a data-free website, and we advertised it on social media and also via the Moya messaging app. As I said, it was data-free, so nobody had to use their own data to do it. The questionnaire was available in the most widely spoken languages in South Africa, including Zulu, Xhosa, Afrikaans, English, Sepedi, Tswana, and Sesotho. And they could just click on what option they wanted to fill it in. We didn't collect any personal identifying information. We couldn't link our responses to anybody, so it was totally anonymous.
Right. And I understand.
Ended up with,
yes, Prof, you may continue.
Sorry. Yes, we ended up with just under 10,500 questionnaires that were completed and that we could actually use in our analysis.
So I understand that you also found that approximately 60% of respondents were actually not vaccinated. With that being said, give me a clear picture geographically how this number spreads, but also when it comes to different groups of the unvaccinated.
All right. So we see that provinces like Northwest and Mpumalanga and the Northern Cape had about 3 in 5 people that were not vaccinated. And this was the provinces with the highest percentages of unvaccinated people. The Free State had the highest percentage of most vaccinated people, with just over 50% being vaccinated. So that was quite an interesting spread across the provinces. We also see that when we're comparing different groups of people, more women, for example, than men were not vaccinated. We also found that the younger people, that is people under 34 years of age, there were approximately 3/4 were not vaccinated, compared to about 1/3 of people older than 35 years of age. But as I mentioned earlier, this could possibly be due to the fact that we did our survey during the month when the younger group finally became eligible to go for vaccines. We also see that less educated people, approximately 3/4, were not vaccinated. And by less educated, I mean, I'm comparing this to people with a tertiary education, where less than half were not vaccinated.
Yeah.
We also found that sorry.
Yeah, sorry, we're running out of time, Prof, and I know that there's so much in terms of detail, but that gives us a consensus, right? A general understanding of geographically and also the different groups. But before I let you go, just briefly, if you may, under just 20 seconds, tell us about where people generally get information about COVID-19 from, because we often hear about fake news and misinformation. That could give us a picture of where, or rather direct source of COVID-19 and information on the virus and the variants might be coming from primarily.
They were mostly getting the information from social media, which is a concern because we know about a lot of misinformation that's been spread there. Then they were also reported getting information from television and TV, and then a far lower percentages were actually getting it from healthcare providers, which would be a good source of information.
I couldn't agree more with you, but thank you so much for speaking to us. Professor Michelle Engelbrecht from the Centre for Health Systems Research and Development. Quite an important and detailed study, just giving a picture there around vaccine literacy in South Africa.